In the final part of this presentation, talking about setting up a health justice partnership, we're going to hear from some of our presenters about how they've connected the work of providing legal services in health settings to opportunities for lasting change through policy and advocacy. So, Faith, has there been work that you've done between Justice Connect and CoHealth that's really had that opportunity for lasting or systemic change?
We have done a little bit of joint advocacy. Earlier this year, there was an inquiry, or they've established an inquiry into elder abuse, and that was through the Australian Law Reform Commission. And there was a whole range of issues that the inquiry was looking at, but there was one chapter dedicated to health services, and two of the key things that they wanted to look at was how could we support health professionals in addressing elder abuse. And our health justice partnership is focused on addressing elder abuse. And the second thing that it wanted to look at was what is the value of health justice partnerships. So both Justice Connect and CoHealth prepared a submission responding specifically to that chapter, addressing those particular issues. So the inquiry is still going on, so we'll have to wait and see what effect that will have.
So one policy work we did a little bit of work on. Actually, this was done just before I started by the health justice lawyer before me. So I was assisting people who had a disability, and as a result of those disability, they had their children taken away from them. So there was a joint submission with Bendigo Community Health around that, and getting case examples and working around that. I'm sorry, I don't know a lot more detail in relation to that because it was prior to when I came, but we're always looking out for different opportunities. I believe there was law reform about people who had autism and the disadvantages there. So I spoke to some workers at Bendigo Community Health Centre around their examples and experiences around that, and the barriers that people with children that have autism face. So there have been some examples where we've done that, and we're always looking out for opportunities. And the great thing about Bendigo Community Health Centre is that we have key champions at senior level management who are always supportive and willing to do policy change and other things as well.
Have we got anything from other presenters that they'd like to contribute?
I might just add that we've prepared a number of law reform submissions arising from our work in health justice partnerships, but I suppose most notably we prepared a submission to the Royal Commission into Family Violence, and we then gave evidence at the Royal Commission in collaboration with the Women's Hospital. So the Executive Director of Clinical Operations, as well as a midwife from the Royal Women's Hospital, as well as I, provided evidence in relation to a number of factors. But obviously I was talking specifically in relation to the Health Justice Partnership that we provide there, and the way that a free embedded legal service can have an impact on women experiencing family violence in particular. Another systemic issue that has arisen out of our work at the Women's Hospital has been a number of queries around birth registration statements. So we have had a number of women attend our legal service at the hospital who have asked us about a number of questions arising from the birth registration process. And had we not have been embedded at the hospital, I don't think that volume of questions would have come to us as a general legal service. And as a result of that, we've been in a fortunate position to be able to advocate on behalf of those women to a number of different places. We've written letters to the Attorney General. We prepared a submission to the Victorian Law Reform Commission when they were reviewing the birth registration process a number of years ago. And we have had some discussions with the Registry of Births, Deaths and Marriages about how the process might be seen to be more straightforward for women who have got queries around the birth registration process, and in particular for women who are experiencing family violence. And those conversations are ongoing.
Anything else?